Hi, my name is Lauren Masi. I'm a doctor of physical therapy and board-certified clinical orthopedic specialist. I'm also the owner and clinical services director of Lafayette Physical Therapy and Bay Area Physical Therapy. Today, we're going to talk about using physical therapy to get to the root cause of your pain. The number one thing that I hear from patients on our evaluation day is that we spend so much more time with them, and we definitely take what they feel, what they think, and their goals into consideration. A lot of times nowadays, unfortunately, when they go in for their doctor visits, they might be in the office 7 minutes or less, is what I heard in some of the recent research. And sometimes the doctor isn't even putting their hands on them to do an actual assessment of their orthopedic problems. When you come to physical therapy, we are going to understand how to best suit your needs and look at the whole picture. We understand the structure, we understand old injuries, we understand repetitive injuries and impact injuries, and how all of these things can play a part in your current injury, and also how we can get you back on track. We also will assess how you fit into your environment, how your desk setup may work for you, even how your car seat might be affecting the pain that you're coming in with. Physical therapists are all trained in school on special tests, things that we will do on evaluation day, where we position your body in certain ways, we resist your body in certain ways, and that information can help guide us to the structure that might be injured. We know that our special tests can only assess to a certain extent. Doctors still believe that MRIs are the gold standard for a lot of conditions. At Bay Area Physical Therapy, we use diagnostic methods that other clinics don't have access to. In recent years, we've been able to bring in musculoskeletal ultrasound and electrodiagnostics, including nerve conduction studies and EMG, into our practice. This has opened up huge new doors for us and for our patients to help get to the root cause of their pain. Oftentimes, we do our testing and the evaluation, and we have a very good idea of what we think is going on. But again, we don't have x-ray vision, and that's where things like this musculoskeletal ultrasound can really help us look into the body. I can see structures of the joints, soft tissues, tendons, ligaments, and I can see if I see any tearing, if I can see any tendinitis or bursitis, and then I can give that information to your physical therapist to help customize your program. For example, if you have a tear and we weren't sure about it before, we might need to modify your treatment and maybe back off on some things to make sure that we're not flaring anything up, or we might have to refer you to a physician. If there's something like tendinosis, which is a chronic wear and tear on a tendon, we might want to make sure that we incorporate things like instrument-assisted soft tissue techniques, maybe even some cupping. We're going to change some of your strengthening to include eccentric or lengthening kind of loading. Those are the known treatments that can help those particular conditions, which we otherwise wouldn't have been able to see without that imaging. Also, if you have numbness or tingling in an area, we might need to figure out, is that coming from your spine, from a disc injury, or could it be an entrapped nerve somewhere down in your arm or leg, or carpal tunnel? Those are some of the other diagnoses that we can help really get to the root cause of from day one with this additional diagnostic testing. We want to make sure that we figure out as soon as possible what the root cause is so we can customize that program for you. If you're interested in our physical therapy services and some of our advanced diagnostic testing to help us get to the root cause of your pain, please call our front desk today to set up a complimentary consultation or evaluation. Thanks and have a great day.